from Los Angeles, California. This is Now Daily with Robert Crawford, uncovering real stories worth sharing. Join the talk at nowdaily.com/show.
Welcome to Now Daily. This is Robert Crawford. I'm here. Tonight's episode, we're going to be talking about healthcare. Big debate. I think it's a pretty big political topic. We're talking about the healthcare current system, the problems with it, how can we improve it, what's being talked about as different solutions. We're here tonight with the Octagon doctor, Dr. Yared Vazquez. Is that how you pronounce it?
Yes, sir.
Okay,
you did.
Perfect.
Fantastic job.
Okay, awesome. So, I'm glad to have you on. I saw you first on the Tinfoil Hat podcast, and, I've been commenting on their videos for a long time because I feel like Sam Tripoli, knows the grasp of the problems, but a lot of people think the solution is more government control. And I think you did a really good job explaining that a lot of the issues with the system are actually caused by the government. And you went into a lot of detail on first just becoming a doctor. Tell us a little bit about what it takes from the moment, I guess were you like a little kid or a teenager when you decided to become a doctor? Tell me a little bit about that process.
It was wild. My personal experience was a little bit different as my background, I lived in extreme poverty in Puerto Rico, in public housing projects in the slums, basically. My dad was a paramedic. I loved what he did, and I loved how he treated people, and the way that people were really grateful when he took care of them. Whenever there was a shooting or a stabbing where I lived, instead of running away from the problem, my dad was running towards it, towards the screams and towards the problem. And I love that courage, and as a kid, I looked up to it. So it was only fitting that I, as a teenager and as a young adult, I'm like, no, you know what? I want to seek this career. It's really, it's going to be really validating, and it's going to be really fulfilling personally. So I put all my chips in that basket, and I went all in. So it took, quite a bit, because I did a lot of mobility, social class mobility. So it's like extreme poverty, working my butt off in school, really putting in the hours to, getting accepted into med school, and then having some mobility. So I was able to see, the different social strata and feel, as I climbed a little bit out of poverty. I was a medical student and a resident, and I made, a little bit more money. So I'm middle class. And then I become a third-year resident, so I'm making a little bit more money. So I'm getting...
so it's like a slow ladder that had to go up, which is really the American dream. I mean, everyone dreams of, making it and becoming a doctor or a lawyer or, a high-end profession like that. How expensive was the school? I hear that's really a huge part of the cost is just affording the medical school.
Yeah, the big cost. I mean, and the government gives you, some ridiculous loans with horrible interest rate, but you're young and you're short in the tooth in experience, and you just want to get it done, get the career done. So you take these loans. So paying for it initially is not an issue, right? You take the loans, you worry about passing your tests and about doing excellent and developing as a doctor. But the cost, really, it's around, I would say, at the end of the day, it's around $250,000. So it's $250,000, which with interest could go up anywhere from 350 to 400, and sometimes even $500,000 if you don't pay up quickly enough, or if you don't making the payments high enough. Most physicians, right off the bat, right off school, have to defer the loans, right? Because you're going to be a resident and you're not going to be making a lot of money. You can't pay loans. You make, as a resident, you're making maybe $3,500 a month, something like that. Mm-hmm. So your first 3 years as a doctor, you're kind of middle class. You're middle class. So the loans, you defer them because the payments are like maybe $1,500, $2,000, and you can't make that payment. It's 2/3 of your income. So all those years, your loans are gathering interest and growing. And when you graduate, it's like when you graduate from your specialty and you start another job, you already have, it's indenture servitude. I mean, you have to make this huge payment, so you can't be picky about a job. You cannot say, okay, I'm gonna put a little money aside and open my own clinic. Before it was doable, but now with the expense of buying all the hardware, Obama made us, pretty much Obamacare, and the electronic health records that are mandatory. So you have to, from the get-go, be able to, okay, I'm gonna get a brick and mortar, get a site, get everything that has to be done, get a nurse, maybe have her salary, insurance, electricity, water, you name it. Plus getting a ton of computer hardware, servers, paying the huge fees of the tech giants that are owning these electronic health records. A lot of people don't know, but a lot of the people that own Google, that own all these other tech companies, have stakes in the electronic health records. So they have their hand in there too. So big tech has
Interesting. Yeah, I mean, I think that was a lot of Obamacare, right? We saw him spend, it was like over $2 billion or more for the website, the Obamacare website, which was a disaster. I mean, I develop websites. I don't have no idea how you spend that much money and it still becomes horrible.
Yeah, it's a thing that, I mean, government. I was on the Grimerica podcast, it's a podcast from Canada, a couple weeks ago, and we talked about a phrase came up, and we're like, we're talking about the government, people being eager for healthcare to be run completely by the government. I'm like, what agency that the government runs smoothly, that we're like, you know what? We want government running healthcare. I mean, no office is complete. Nothing that any government. I mean, it's a bipartisan issue. I mean, it's all the parties involved in running our government.
I mean, I tend to agree with you. That's just the conclusion I came to. But a lot of people, I think I already just discussed a few major issues, right? One was the cost of your education. And that education is really mandatory, correct? So the government makes you get the correct degrees, pass the correct standardized testing. On Tinfoil Hat, you were talking about even the tests have a cost.
Yeah, they do. I mean, let's say you're going into med school, it's your first year. You have 2 years of med school. At the end of the second year, you have to take a test that's called the USMLE, the U.S. Medical Examination and Licensing exam, step 1, which is about maybe 650 to 700 multiple choice questions over 8 hours. It's an 8-hour long or 9-hour long test, and that has a cost of about maybe $1,500 to $1,600, plus all the material that you buy to study it. All the courses, which could run $2,000-$3,000 in courses and books, because this is apart from med school, right? You're taking tests inside med school, like your biochemistries, anatomy, all that stuff. So you're crunching and you're doing that, but at the same time, it's in the back of your head and your subconscious. Oh crap! In 2 years, there's a toll on the road, which is the USMLE. You don't pass the USMLE step 1, you don't continue to 3rd and 4th year. So it's a hard stop on your career. It's the first time that there's a kind of a government or an agency run toll road for the medical practitioner, and that test makes hundreds of millions of dollars in revenue a year.
And so does that go just straight to the government or to like a third-party agency that they contract with?
It's a third-party agency, but all those funds, they're never accounted for. They're never, just like, to put a kind of left field example, all the opiate stuff happening, right? All the senators and the opiate.
The Oxycontin. That's a whole thing I want to get into, but yeah, I mean, that's crazy.
They're making laws for you to get like a continuing medical education. So they make you take this little course that's $190 something dollars to give you a certificate, and then you can carry on continue practicing without losing your license because you got educated on opiates, which the educations were crap. So that money, where does it go? It's private companies that make all this money. So it's kind of a...
And then they're giving a portion of that back to the politicians that they got in their pocket.
donating. They're donating that money.
So let's like look at devil's advocate here. So if someone was, on, I guess, the quote unquote left, and they believe in big government and that it's necessary, you would say, well, those tests are necessary to protect the consumer and to make sure the medical field is safer. Do you feel that that really is what happens, or would it really just be on the consumer? Let's say in a different universe, we're in a parallel reality where we don't have any requirements. You don't have to go to college or anything. You put on a doctor's coat, you can call yourself a doctor. Is there really like a happy medium there, or does it really just create a huge barrier to entry?
I would say it's just a barrier to entry, because if you travel 20 years in the past, which is not that long ago, 20 years in the past, there was just one test, which was called I think it was called the foreign, or I don't remember exactly the name, but it was just one test. And for example, board, if you only took one test to have your medical license. And it was about $200 or $300. You passed it, and then you got issued your license, and you didn't have to pass any board certification or anything like that. So if you wanted the prestige that would come as being part of one of these organizations for let's say you're a pediatrician, besides your USMLEs and stuff, when you graduate from being a pediatrician, you can practice like that, but you can also go to the board of pediatrics and pass your board of pediatrics, so you're board pediatric certified, right? All those things 20 years ago were not a requirement, complete requirement. And the health outcomes have not changed that much. Healthcare has not changed that much, and there's no solid data, which was going to be my next point. Right now, there's a whole bunch of lawsuits right now being taken up against these companies that make these tests, because there is no black and white research showing the benefit. Like, hey, physicians that pass these tests are more adept or more prepared to take care of you. So it's taking away time from patient care, hours for you studying. We're talking about it's hundreds, if not thousands, of hours of your asset, right? Doctors are asset to any nation, right? Because you want doctors that are really prepared, that are well compensated, that are well rested, and that are willing to work a lot of hours and bring health to a lot of people. But instead, we are transformed into these little tiny machines that have to memorize really useless facts. To give you an example, a common question in the USMLE 1 would entail things that you're never going to say. So they're testing you on your capacity of reading journals. Okay, so that's one of the things that they're
reading comprehension.
Yeah, so they'll give you a minute and a half to read a medical journal, an excerpt of a medical journal, and then within that minute you have to read the question, and answer 2 or 3 questions out of that question, which is, I'm like, if you're superhuman, maybe you could slow time and do it in 10, but the course prep people are telling you just guess and carry on. If that question comes up, you're probably going to get it wrong, and it's going to eat up at your time. So we're talking about really dirty tactics like distractors in a test, and the difficulty of the exam has increasingly got harder and harder in the last 10 years. Like, to give you an example, when I took the test, the score to pass it was 185. Right now, the test to pass it is 205. So it went up 20% in difficulty. So you're creating a bottleneck for doctors, right? So it's becoming so hard, increasingly hard to get, and people are still passing it. But the difference is, because the argument that I always receive is like, you know what, Vasquez, just don't even talk about it because people are still passing it. But when you go and analyze it a little bit deeper, yes, they're passing it, but that means that they are compromising something to be able to pass that test, right, you're losing a little bit of your connection with patients. You're being deeper in just
right. I mean, learning the things that are not going to affect you day to day takes away from you learning what's important and then being able to innovate too.
Yeah, correct,
I think
correct.
let's get into that a little bit about, we've talked about now getting the degree, and I want to come back to maybe the cost of that in a second. But on the flip side, it's also the regulations of developing new treatments. I mean, it seems like not only do they make you memorize what you said, most of it's memorization, they kind of put you in a box and say, this is the system. You can't really go outside the system or else you may lose the license.
Yeah. That's a fantastic point. I'm glad you brought it up, because a lot of times in social media, I try to be really active in social media just to reach out to counteract a lot of the wrong information, and to really connect with the public, to let them know what doctors are about. To give you an example, most people, there's a lot of anti-vaccination movement. A lot of people think that we are in the pocket. The pharmacy is in our pockets, putting all this money, and that's why we practice. And yeah, we're encouraging vaccines because they will leave money. So, but what most of the public don't know is that we are allowed to practice medicine within guidelines. So there is a task force, USPSTF. There's a task force in the United States and the CDC as well that lay out guidelines. To give you an example, the guidelines for hypertension are put forth by the Joint National Committee for Hypertension, and they come up with algorithms for, hey, if a patient has his blood pressure above 130/90 and is diabetic, you start with this, and that. And then you could kind of move a little bit freely around that algorithm, but the moment you stray away from it, it's not that they're going to come after you, but if something happens to that patient, and that goes to the court, and they find out you kind of skirted the guidelines, first you're going to lose that case in court. So you're going to lose a lot of money, and your insurance is going to drop. Your insurance probably will pay for it, but the price is going to skyrocket. And second of all, they're going to go directly to that. So people want that alternative medicine. Sometimes the public wants you to approach things differently, but your license, what permits you to make a living, is intimately related to guidelines that are not created by us. I mean, let's say you're coming in with a condition and they're using a specific medication, alternative medication in Europe, or in Australia, they're using a certain, a medicinal plant, and I could get an extract and maybe we can try that out. I would be discouraged from that because, hey, maybe something happens, maybe people can go to court with this, or maybe you just get if somebody finds out about that case, another doctor, and they see your documentation on it, then you could be in trouble. So you have to practice. You have to play by those rules.
You could be in trouble both civilly and criminally. Yeah, so they really kind of box you in. I mean, I think there was a really good documentary that I saw. I can't remember the name of the doctor. I think it was Dr. Brzezinski, who was talking about some cures for cancer, and he was basically identified a protein within urine samples, and he noticed that people with cancer had a very low amount of this specific protein. So he was basically giving them substitutes, high levels of this protein, just in an ingestible form, and they basically took him to court. He lost his license. He went through a decade or two of different court battles, ended up winning in the end. But it really shows you that if he was correct and it did help his patients, he really can't even treat them with that because of the current system in place.
Exactly. You're right. It's you're tied you're tied at at the hip to those rules and regulations and your law and your licenses associated to all those guidelines. So there are metrics that, to give an example, Medicare or Medicaid use to make sure that you're abiding by that in the electronic record era. They have HEDIS, health efficacy, something, and MACRA. So there are active not movements or active campaigns to make sure that the doctors are gathering information or documenting information that the government can gather and say, okay, Dr. Vazquez is measuring height and weight every visit. Dr. Vazquez is asking about depression every visit, which is really intrusive if you think about it. So all those things. To give an example.
Now, the government's supposed to have they shouldn't be able to see your medical records. With the electronic system, are they able to access those?
Yeah, I mean, in theory, your identifiers, let's say your name, your social, your address, is not available to anyone. But the rest of your data, like your blood pressures, your age, your diseases, let's say that could be sold, and that's currently been sold by the, to give an example, electronic health record companies can sell that data. They claim that they strip it from identifiers, but with AI, I was telling Sam, I was talking to Sam Tripoli through Twitter. We're going back and forth about it because they can run that information through AI and probably approximate exactly who that information belongs to.
So then they could target a diabetes patient with diabetes advertising on YouTube or Instagram. A use like that is what you're saying?
Yeah, absolutely. I mean, we see it with Facebook all the time. I mean, anytime if you go to Google and you have a cold, then you Google, ginger for cold, and then you go back to Facebook and you'll see, a couple of advertisements for clinics near you, a couple of advertisements for your big clinics, a couple of advertisements for Robitussin, for to name a few. People use that data that you browse, so they do the same with the electronic health record data. Mm-hmm. So it's a win. Mm-hmm. It's a win, and for doctors, it's a massive loss. I mean, we're spending approximately 50%, 40 to 50% of our time data gathering, which is data processing. We're the most expensive census takers right now in the job market because that's what we're doing. It's 15 minutes to see a patient. It takes me 5 minutes to type a note. Even with templates and all that stuff, it takes me 5 minutes to type it up in there. Then I have 5 minutes to talk to you, and 5 minutes to give you a physical exam. So you do the math, right? It's a ludicrous. It's a very ludicrous appropriation.
Do you see any benefits to it?
I would say if we play devil's advocate, if we're looking at the bright side, I would say that getting electronic prescriptions, it's easy because you fax it to the pharmacy and it's good. But the thing is that electronic health records started to speed up the process, right? Mm-hmm. Oh, we're going to go paper free. Doctors print too much. We're printing double or triple because if you ever gone to an urgent care or an ER, what happens when you're discharged? What do they give you? A big stack of papers
they'll need a copy of it, I'm sure.
Yeah. So you're printing more. There's no interoperability. Let's say you're an orthopedic surgeon. You're my favorite orthopedic surgeon. I have a patient with a boxer's fracture, and I want to communicate all the stuff that I did, the pictures I took of the fracture, my vitals, all that stuff. Guess what I have to do? If we don't have the same electronic health records, I have to print everything I did and fax it to his office, just like I would do in old school when we were writing.
I thought that's what they did, though, was standardize the medical records electronically. Isn't that what Obamacare did?
Yeah, that's that was their initial claim, but there's no interoperability. Like, it's been 6 years now, seven, since it's been almost 7 years since it's been mandatory, and there's no interoperability. So if a hospital doesn't have the same EMR, you cannot cross communicate, because why would you? I mean, if you're a big company, a big player, why would you make your product compatible?
I mean, it really seems technically like it would be very simple. You could create a medical blockchain, right?
Yeah, that's what
and
it's
then
being created
store it
right
in
now.
the blockchain, and then anyone would be able to access it. But yet, it would still, you can maybe have a unique code for that patient they would have to give you. I mean, technically, it seems like it would be fairly straightforward.
Yeah.
But when the government tries to do it, what you're saying is they put something down on paper. They have no way on how to properly execute it. They spent billions and billions of dollars, and now you're just in a much worse situation.
Absolutely. And you said blockchain. I have a good friend, Dr. Leah Houston, that's working with HPEC, and she's using blockchain technology. You definitely have to have her on for her to explain that to you, because she's doing some cool stuff with physician credentialing and blockchain, physician identity, and all that good stuff. So you have to get her. I'm going to get you the context for her. But you would think that would be as simple as utilizing that technology, but it's just, it doesn't look like it's in the near future, because it's I don't know if it's competition for them, and there's no incentive to improve the product. I mean, when something is, I was mentioning this in the Gramerica podcast, that there's no incentive for them to get better, because it's mandatory. So your hospital, let's say your hospital, a big hospital system, spent 2.5 to 2.5 million dollars in adopting electronic health record, and 5 years into it, everybody hates it. It's causing a lot of delays in care. What are you going to do? You're not going to scrap it altogether and go back and try another one. So people are caught in this web of necessity with electronic healthcare records, and if you have one you don't like, and you double down and you bought it, and you have to keep it, which is ridiculous. They have the perfect business model. The government makes their product mandatory, so they don't have no incentive to make it better.
Well, yeah, and I think that's what really scares me, is because we've just identified a number of problems. One, the cost to become a doctor is astronomical. Takes years and years and years, hundreds of thousands of dollars, lots of studying, and really it's not producing any better doctors than if they probably wanted to do it on their own. Then second, once you become a doctor, they have very strict guidelines on what you can do with your patients. And if you get out of those guidelines, there's civil and criminal penalties. And from what I've researched, it seems like medicine, maybe you know a bit more about this or not, but medicine in the early 1900s was very different. And then basically the oligarchs came in and gave a ton of money to these colleges to get on their boards and said, you're going to start teaching pharmaceuticals. We own a lot of these pharmaceutical companies. Many of the drugs were actually based on petroleum products. And that kind of started this whole beast of a system that we have now. Would you say that's accurate?
Yeah, I mean, that's completely accurate. Back in the 1900s, to be a physician, you had to be of a prominent family. So the physician was, a prominent figure among those elite, right? And I remember in the 80s, when I was a kid, I remember seeing doctors, and I was like, oh my God, that's somebody that has some pull in society. Even as a kid, I was a bit of a weird kid. I read a lot of old books, and I was quiet. I probably right now I would be put on the autism spectrum if I was born in this era. That was always internal and analyzing. So you saw the figure of the physician, and it was part of that. But it has become something else since that power was stripped away, and it's been slowly but surely, just like a vice grip or an anaconda coiling around you. They've been taking away the power. They've hyper regulated the physician, and it seems like it's almost, if you when you put the pieces together, it sounds really conspiratorial. You're like, oh my God, are you gonna go that route? It's like, wait, no, it does not necessarily has to go that route, but you have to analyze it through those lenses too, because pharmaceutical.
Yeah, you just have to go where the facts are leading, right?
Yeah,
What's
yeah,
causing
exactly.
this? We can all agree, and I think both sides of the argument, whether you're for the big government solution or you're for free market or somewhere in the middle, you can agree on the problems, right?
Oh yeah.
And we've just talked about them. The costs are high, very high. Most of the cost too doesn't even come to the experts like you. Most of it just gets absorbed by the insurance companies or the large hospital systems, or the government regulators. All these middlemen that are taking up the majority of the gross income, I would imagine.
Yeah, yeah, absolutely. And healthcare before was controlled by the free market. We're talking 50s and 60s. It was free market. I mean, Kaiser Permanente, health insurance has started because big companies wanted to provide healthcare coverage to their employees as a benefit. But while they were doing that, they found out, oh, wait a minute, there's some money to be made here, right? And they rolled out the HMO rollout, and doctors were against it in the beginning. But
how long ago was this? Just a couple decades?
Just a couple decades, and little by little, the next generation forgot. Maybe the generation that died in the 60s was still, not buying the hype of insurance, but there's like a generational amnesia with physicians. So this that I'm talking about, in 20 years, doctors are absolutely not going to know anything about it if we don't do something right now. So this generational amnesia, it's the long game, right? So it's what big companies and big investment firms bank on, that okay, this doctor that has a voice has maybe a shelf life in the market of 25, 35 years, maybe 40 years if he's really durable. So that's not going to be such a huge issue, because younger doctors are going to be trained, and they're going to forget all about this, and they're going to be so caught up in all those distractions, tests, and electronic health records, and quality measures, that they're going to forget about the fact that they are the engine that drives healthcare for the time being, right? Because we're being substituted by non-physician alternatives like nurse practitioners and PAs.
Yeah, I see now they're allowing in some areas nurse practitioners to do surgeries. Yeah. We're just getting into the AI realm of things. I think it's just a matter of 2-3 decades. AI is going to be doing surgeries and probably a bunch of different pretty amazing things. Which there are big benefits to it too, but there could also be big downfalls. So a lot of people talk about, okay, there's problems, everything costs a lot of money, but this is what you hear constantly, right? We're the only developed country, first world country that doesn't have universal health care. And we need to have a single payer system so everyone could have affordable health care. What do you agree with that? Do you disagree with that? What are you thinking on that?
I disagree. I say that we already have 3 single payer systems, which are the VA, Medicare, and Medicaid. So when they say single payers, that's just one party is responsible for the payments, and that's the government. And it's coming directly from the budget, it's the government budget. And we already have 3 systems, right? So if you're below the poverty line, if you make less than $12,000 a year, you qualify for Medicaid, and you have pretty good coverage, some decent coverage. Medicare, you qualify for Medicare when you're 65 and above, you retire from your job. Sometimes you can start it earlier. If you're disabled, You can have some sort of coverage, and if you are a veteran, you get treated by the VA, which is government-run, the Veterans Affairs Administrations, that health system. So there's three health system, and that's above 33 or 35% of the population. I would say.
Well, it's really four, right? Because Congress has their own.
Yeah, exactly.
Isn't that separate?
Exactly. You're good. I'm glad you brought that up. So there's all these systems that are in place already. So the narrative, and that's a buzzword I've been using recently. The narrative is like, we need this. It's like, okay, we have it already. Puerto Rico has Reforma, which is before Obamacare was a thing. There was a bit of a experiment ran on Puerto Rico. They ran Obamacare in Puerto Rico with a different name, and it bankrupted medicine in Puerto Rico. It did. Medicine. There is in the island of 100 by 35 miles that has millions of people living in it. There's only one neurosurgeon. There's only one or two neurosurgeons practicing. There's an outflow of about 200 physicians a month out of the island coming to work here in Florida, California, Texas, you name it. So there's an exodus. If you Google Puerto Rico exodus and physicians, you'll get 20, 25 articles per page, detailing all this stuff. So we're looking at our future right here. In Puerto Rico, it didn't work, which is a small subset of American citizens that live down in Puerto Rico. So here, it's about the same, right? It's doing exactly the same.
Yeah, I think you make some really good points. Two things with the Puerto Rican system or any type of universal system that are at least 3 points that really concern me is one, how can you say healthcare is a right when someone has to give you that care? So basically, it's a form of enslavement for doctors and nurses like yourself, where they're you're basically becoming a new age indentured servitude.
Yeah, and it's a middle class. What I say, I made this comment on Twitter, and the person instantly blocked me. They're like, "No, we need universal healthcare." I'm like, "We have 3 of those systems in place, and 4 with if you mentioned the government's own system." I got blocked instantly. I'm like, "Oh, reality was too harsh for this particular."
Well, do you think that they don't know the reality, or that they are willingly choosing to ignore it for their own selfish reasons?
Yeah, I mean, it's when you're choosing to go all in into any philosophy that or political affiliation that you have, you are missing the opportunity to be scientific about your choice. Be informed about everything that you can be informed. Like the scientific method. I was telling Sam I don't know if you remember in the Tinfoil Hat podcast that you have to, any type of information or any type of theory that you have to have two ways. Your theory could be right or your theory could be wrong. So when you close your mind to information, you could be wrong. You have to accept both of the outcomes. That's the scientific method. And when you tell people, "Hey, we have these systems in place already, and they are not that good. They do some good, but in reality, it's a battle for the healthcare dollars of the middle class, right? The middle class gets dragged into this without having to be dragged into this. I mean, the government. I am all for having everybody covered. And having health coverage for all kids, but
I mean that's where they get you, right? Is pulling on the heartstrings, because they say, "Oh, if you don't want universal health care, you're an evil person and you don't care about people." When I think, at least where I'm coming from, and a lot of other people that believe in a more free market solution say, actually, it's the opposite. We care more. We care just as much or more about people. And we think that going the universal route is a huge mistake. And you just laid out several points to prove that. One, it's going to enslave you, which means, just as you said in Puerto Rico, most of the surgeons have left. They're just not going to do it. They're going to change. I've talked to doctors here that are my clients, just in LA, who have left the profession entirely. and opened up separate businesses because they didn't want to deal with the regulations. They were upset about the pay that they were receiving. Everyone thinks you become a doctor and now you're making, hundreds of thousands of dollars a year, which isn't necessarily true for a lot of doctors. Would you say that's correct?
Correct. Because you're paying most of the money that you're making, you're paying to loans and your regular day life, and our tax bracket, of course, is really high. So at the end of the day, the juice is not worth the squeeze unless you love it. For me, it's worth it because I absolutely love what I do. I take time to make videos, to be on social media. I go on podcasts. I do because I love what I do and I want to inform the public. But for most people, it's such a hard thing to go into. And it shouldn't be, because we have so many gifted, wonderful people that could be coming into the profession, but they see it from the outside, even as college students, and they're like, maybe this is not for me. Maybe I've had a lot of biology students come in as patients, and I like to encourage them, like, hey, you're going to college, what are you going to do? Maybe medicine's for you. And they're like, no, if I go there, I'll probably do a physician assistant. It's a shorter time. I won't be in so much debt, and I'll see patients just like you. And I'm like, oh shit, he's right. He's absolutely right. But it's not the same. 2 years out of college to see patients, not the same, I tell the comparison all the time. Like, I love my physician's assistants. I work with physician's assistants. I work with nurse practitioners.
They're doing a lot of the heavy lifting, right? They're taking the blood samples. They're kind of doing most of the normal day-to-day stuff.
They're doing doctor work right now. Before it was that, but they're doing a lot of doctor work right now. They're seeing patients just like I see patients. They're prescribing just like I prescribe. And most of the times, when you go to an urgent care at ER, who's seeing you is a mid-level. That's the nomination, right? A mid-level practitioner is a nurse practitioner or a PA. And they're fantastic to help with if the doctor, to stretch the reach of the doctor. Let's say I'm an endocrinologist, a specialist in diabetes. I absolutely need to see a lot of patients. Absolutely. My specialty is so unique and so many people need it that, hey, I'm going to get this physician assistant to help me broaden my reach. But I have to supervise their decisions. I have to go over their charts, discuss the cases with them. In that way, but the way that it's being pushed right now on people is, no, it's a complete alternative to doctors. There's online mills. There's online schools. So if you're a registered nurse, you can go online and take 2 years of courses with 0 clinical hours and be seeing patients right next to me in the next room, be seeing patients and prescribing medication. What took me 13 years to achieve, you achieved in 2 years, plus you're doing the same, and companies pay you a third of what they pay me. So the math is there. The way big companies gain income from this is like, okay, I'll have a doctor, but I'll have three nurse practitioners under this doctor's license.
Mm-hmm. So that makes a lot of sense.
Instead of paying 25, instead of seeing 25 patients, I see 100 patients, but I'm paying for what I would pay for 2 doctors, but 4 people are doing the same job. Mm-hmm. So you extend the reach. So that's the financial gain. That's the play. That's the game right now that's being played.
And who does that help? I mean, it really only helps the large hospital systems.
Yeah, it does. It helps the large hospital system. It helps insurances because the insurances pay for the services. So they prefer. They could see an internal medicine doctor or a family practice physician, but they could have insurances pay half.
Yeah, I mean the insurance is interesting, right? Because you were just saying we didn't always have the system where you had to have insurance. 50, 100 years ago, insurance barely even existed. Yeah. It seems like in the 50s and 60s is where they started getting into employer insurance for some extra benefits. And I think that's one of the big problems because I'm an entrepreneur, right? I own my company. So when I have insurance, I write the check. And when Obamacare kicked in, it was right when I was becoming an entrepreneur. I was, under an employer, it was a large company. They were paying for it. I never noticed it at all. All they gave me was the little insurance card, no problem. Now, when Obamacare kicked in and he said, you like your doctor, keep your insurance, and as soon as it kicks in, I get a bill from Blue Cross Blue Shield saying, we're canceling your insurance plan. You have to buy a new one. I've been paying like $115 a month with great insurance. Now I'm paying hundreds of dollars a month with a huge deductible that barely covers anything.
Exactly.
To me, I was like, they just totally screwed me. They just totally screwed me. They lied to my face, and then they turned around and screwed me. But most people are paid from the employer, so they don't even notice it.
Yeah, and what that did is that instantly employers played with that threshold. To give you an example, Walmart is not going to give their employees raises because they want to keep them just at a poverty line where they can apply for Obamacare, for Affordable Care Act insurance. So all those patients that had Walmart before had medical insurance plans for their employees, but they made a crap ton of money once Obamacare kicked in because they saved all those dollars. So instead of paying the insurance, they paid the not the fee but the penalty for not providing healthcare to their employees, which is infinitely more affordable than paying insurance. To say that they had to pay, they're probably getting discounted insurance, so they probably paid $5,000 or $6,000 a year per employee as part of their package to get them health care, and that's a gross approximation by me. But instead, they're like, okay, we can pay $1,000 per employee just as a penalty, so we're saving a couple thousand dollars per individual that we don't have on our health care. So we make money. So big companies are incentivized to pay a penalty and not provide healthcare, so their employees can be off of the government healthcare. So that way, big companies that are, by the way, are lobbyists for all these things, and they pay up. They're making huge donations to keep this system going.
Yeah, I mean, it was really the lobbyists that wrote the bill. They pretty much came up with the whole thing. They had Obama and them in their pocket to get this thing passed. I mean, you see it over and over again. And then they put the lobbyist companies, they're basically former employees, then run the FDA and these, administrations. The bureaucracy I'm more concerned of, because the FDA, to me, is one of the biggest problems that we have in the medical field, because they're preventing real cures from coming to the market.
Innovation. Yeah, it's a big defense system. With the FDA, the amount of money it takes to get a new drug through, it's gargantuan. So you see a lot of diabetes medication be developed. You see a lot of erectile dysfunction medication be developed. But when's the last time you heard about a new antibiotic being developed?
Or even colloidal silver. I actually make my own colloidal silver, and I've been prescribed antibiotics, which didn't work for me, and then I've drank in colloidal silver that I made on my own, cured me within 48 hours. But yet no doctor is going to prescribe that.
Yeah.
Most don't even know about it.
Yeah. I've had experience with colloidal silver with chronic ulcers and in the spray form. But yeah, you're absolutely right. It's a nightmarish, hyper control that they have. But I think the positive side of this is that it's been so uncomfortable and so unbearable that doctors are just getting on social media and reaching out, and this is the way that
educating. Yeah, I mean that's really the best way to change this, is to educate people on why the system is broken and how to have the solution. But yet you have the media, which is very obviously the mainstream media, large corporations, all in for universal health care. And a lot of people would say that it was their plan to do Obamacare to make the system so bad to then push people into the universal healthcare system.
Yeah, but we have, yeah, you're absolutely right. And we have our alternative to this is direct primary care, DPC, which is doctors are starting to get their offices again, and they're starting to have transactions directly with patients. So it's not concierge medicine. It's more of pay for your care, right? So there's more imaging centers. People should be encouraged or feel that there's a little bit of hope, because more and more doctors are providing more alternatives for people to reach them, be outside of the system. And that's the free market that we need. But until the kind of the addictive circle of the Affordable Care Act and Obamacare is controlled or modified, DPC won't be able to get.
It would be limited, yeah, I would imagine.
Yeah, it'd be limited. Like I see, to give an example, there's a famous comedian in LA, Brody Stevens, committed suicide.
Yeah, that was just a few weeks ago. Yeah.
Yeah, a couple weeks ago, in March, I believe, and all the month of March, I have my own telemedicine platform where I see patients for $15, $20. It's an app,
which is great. Yeah, like Doctors on Demand.
Exactly. And for all that month, in honor of Brody, I saw patients for $5. If you had depression, you just wanted to talk, maybe you wanted to be on antidepressant, or maybe you just wanted to chat with a doctor, I did it for $5. And maybe 20% of the people didn't have money to pay, and I did it for free.
Yeah, I was consulting with a startup company that was like that, a two-way chat specifically for therapy. And I've seen some of them pop up now, which I think is a really good solution because it makes it affordable, right? You just said $5. You don't need to pay for the insurance, which is hundreds of dollars. It's almost instant. You don't have to drive somewhere, wait in a waiting room for 7 hours just to see someone. Right. I really like that. I mean, obviously, it's not going to cure. If I have a broken arm, it might not be the best thing.
Exactly, it's not for you. But maybe you're hiking and something happened, and you have a doubt, or maybe it's other jobs are affected as well. So maybe you have you work for Amazon and you cannot take a break. Then you take a 2-minute break. You call your doctor, hey doc, or you can even chat. If you're a high blood pressure patient, you can send me a text through the app and say, hey doc, I need refills on my high blood pressure medication. Boom, press a button, it's done. So that's just one of the ways, I think the future of healthcare, it's a more direct approach with physicians and patients. I mean, if we're able to drop the middleman, I think we'll be all right. But it's a hard battle, and we're just starting.
Yeah, I know. I completely agree with you. That's what matters is the patient and the doctor, or at the very least the nurse practitioner. The rest of it's just fluff and bureaucracy. And we're in a very deep battle here on which route it's going to go. We're either going to go a lot more bureaucracy, or we'll start freeing it up and really seeing innovation. And I think innovation is going to save lives in the long run and create better medicines and actually cure things. I mean, look at all these organizations, these nonprofits, American Cancer and breast cancer and all these things. To me, I look at them and I'm like, these are just big money schemes. They're pumping in money, but yet they're really not creating the cures. And even if they did, like my example I said earlier, I think the Dr. Brzezinski, who actually came up with a cure that cured like 73% of his cancer patients, he couldn't bring it to market. So, yeah, you mentioned too that one of your specialties is diabetes. Is that correct?
Yeah, correct.
So I want to talk about that specifically because to me, diabetes is becoming like an epidemic, and it wasn't like this a few decades ago.
It is. It's diabetes is just, when I talk about the disease process, I like to talk about what takes you to a disease process. So all bodies have the capacity to be in that disease process. So diabetes is just you've been so overloaded by sugar that your own mechanisms of your body, for most of the cases for adult onset diabetes, It's just your mechanisms to put away all that sugar are overrun. So you start to get these symptoms. You start to get polyuria. You start urinating a lot. You're very hungry. So it's almost like a negative feedback loop. So
Hmm.
it's the way your body works. So that reflects on your patient's surroundings, your patient's style of lifestyle. But if you're caught up with electronic health records, you don't have a lot of time to say, hey, Rob, let me know how a day in your life looks like regarding to food. What's your relationship to eating sweet stuff? Talk about me about this. Stress in your job. Maybe you're really stressed and cortisol, the stress hormone, it's liberating a lot of sugar in your system. So it's that capacity to be the Sherlock Holmes and sit down and explore your patient's capabilities. It's what's limiting us. And diabetes is just, we see it. It's an epidemic. It's systemic because you're not able to. The doctor doesn't have the time to put out the fire and talk to the patient really with comfort and sit down
So you're
for
just trying to get rid of the symptoms in
yeah
most cases instead of treating the
yeah.
underlying, problem. And I
Absolutely.
was at a seminar with Dr. Joel Wallach, yeah, I don't know if you've heard of him. He created a bunch of different supplements. He wrote a book called Dead Doctors Don't Lie, and
Oh yeah, I know.
in his book, he really went on to saying the vast majority of issues are nutritional deficiencies, and diabetes is one of these things. My background's food and beverage, you're medical, so I took multiple classes in nutrition. I went to culinary school. I pretty much have learned as much about food as possible, and I realized that our food system may be purposely done in a way to cause diseases like diabetes. You mentioned the sugar intake is one. Also, there's a strain of wheat that most people don't realize called semi-dwarf wheat, which is the most popular wheat that was used. It was never tested. It was basically cross-pollinated to create a very high yield, shorter wheat. So it produces more, per crop yield. Well, what happened is that wheat, now that they're getting in there and doing tests on it, they're realizing that that's one of the major factors for obesity and diabetes because our body converts it into glucose the same way it does for sugar. And pretty much everything that you see, every fast food place, they're all talking about sugar, wheat, sugar, wheat. I mean, even the food pyramid was the number one thing on the food pyramid with the grains right at the bottom. And now we're learning a little bit about ketones and that fats are actually good for you. So it's almost as if they flipped the food pyramid upside down on purpose.
Yeah, it's ridiculous. I always tell my patients, hey, because I see this every week, IBS, inflammatory bowel syndrome, people with huge bellies, tense bellies, are constipated, they're having diarrhea, they're having stomach issues, and some doctors, they're tossing Prilosec to them and omeprazole and all these medications instead of educating, saying, hey, go make your food portion 24 ounces, eat every 4 hours, drop soda, just drink water, go to more natural raw ingredients, and have a relationship with food. You said, it resonates with me when you say, hey, I learned everything about food. That's what I try to convey to my patients. Have a relationship with what you're eating, right? You see it on the Joe Rogan podcast. We see it all the time. He has a newfound relationship with hunting and what he
Yeah,
puts in
he's
his
been
body.
talking a lot about the carnivore diet. We've
Hmm.
been taught, the media says red meat's bad, red meat's bad, red meat's bad. But when you really dig into those tests, they're not talking about red meat being bad for you. They're talking about nitrates and nitrites, which are preservatives mainly in bacon, sausages. As a chef, we were taught about these, especially in our charcuterie classes. And we were told, hey, try to avoid these if possible. So a lot of those red meat studies are specifically talking about those preservatives and not the actual meat, which I think is a big misperception too.
Yeah, it was, and you don't see anybody. I mean, right now, all the opiate. To give you an example, the opiate hysteria and all that stuff. Doctors were, extremely scrutinized for and they were put in the limelight for opiate prescriptions, but nobody's putting General Mills on the limelight for cereals. Cereals are sugary bombs. Coca-Cola. Everybody loves that Coca-Cola commercial in Christmas with the little polar bears and stuff.
Right.
And that all these companies are directly responsible for loss of limbs, for loss of eyesight, for billions of dollars in health expenditure, because you're putting in your body all this stuff, and they're not responsible for it, but yet doctors are responsible for prescribing opiates for pain and for the deaths, and they get, witch hunted on all media. But all these big companies, since they have all those lobby dollars, they won't get, you will never see any big media outlet going after, McDonald's.
Well, here's where I get into the conspiracy hat aspect, and this is proven facts where General Mills and those large corporations that are producing these products, most of those products are made with GMO, untested. There's really only 8 GMO crops. People say, oh, genetically modified is corn because it's cross-pollinated. No, I'm talking about in a lab, they shot in a specific gene. Usually it's this BT organism that literally, when a bug eats this grain of corn with the BT gene, it blows up their internal organs and kills that bug. And they're seeing that in Europe, where they're banning it in most countries in Europe now. Most people don't realize, they think sugar comes from sugar cane, but like 98% of the sugar out there is coming from beets, and usually GMO beets. So sugar is bad for you just to begin with, but then when you compound it with this GMO beet sugar, it makes it even worse. So, and you're right, where these large companies, I think at least the people at the very top know what they're doing, because the same shareholders also own the pharmaceutical companies. They also own the very large insurance companies. They own the major media companies. So you really are talking about a conglomerate that owns Monsanto. The same person that owns Monsanto is owning the media. And then they run their ads for the pharmaceutical company. That amazes me, where you have CNN demonizing someone like a Sam Tripoli, right? Or Eddie Bravo or an Alex Jones. Yet they're the ones pushing the pharmaceuticals on pretty much every commercial break.
You're correct. Yeah, you're absolutely correct. It's almost an idiocy. It's something that when you are privy to it, and you get, I hate to use the term, but you get woke to this reality. And you see a play in front of you, you're like, oh my God, I have stopped getting frustrated with it, and I'm just like, okay, one podcast at a time, one patient at a time. If I can sit down with people and say, hey, have a relationship with your food, buy from local farms, small farms, farmers markets,
it's getting very difficult. Yeah, you're right. You really should eat organic. We're not even talking about the glyphosates and all these other issues that are caused from it. Everyone talks about, oh, Alex Jones gave frogs, but atrazine's a real problem. BP plastics or BPA plastics is a big problem, causing a lot of hormonal problems. Let's get into, you were just talking about the opiates too, because to me this is a fairly new thing. And from my understanding, how it came about is they created oxycodone, which they then got a patent on, went to doctors in the 90s and basically said, here's a great pain medication. Our studies show that there's a less than 1% addiction rate, which turned out to just be completely fraudulent. Now all these people got addicted to the medication, and then when their doctors stopped prescribing it, they then turned to fentanyl and heroin and these hard drugs to make up for it. Would you say that's what's happening?
Yeah, I mean, what happened is that the drugs were advertised. The opiates are very effective drugs. They've been used for many decades. starting with morphine in the different world wars, and they were widely used for as a painkiller in field surgeries in different war situations in our past. And then, they were improved upon, made in different forms and different delivery methods. But pharmaceutical companies, any company that is for profit, is going to want to take it to the next level, right? How are we going to improve our winnings in the next quarter? So that's how it became a mess, and that's how they started promoting it, and they started with all this BS crap, which I think that helped a lot of it made a lot of people addicted to a certain drug, right? To a certain, when we talk about the fentanyls, when we talk about the Percocets, but it's a social problem as well. You see that, to give you an example, in hip hop music, Percocets, which is opiate medication, is deeply, deeply embedded in the culture. So it's in songs. There's a song. Future has a song. It's called, Molly and Percocet. So.
Right. I think just about everyone knows that.
Yeah. So it's deep in the culture. So is it doctors prescribing it? We got some pushback, and I would say my prescribing habits before 5 years ago, I didn't like opiates because clearly nobody needs to have their extreme pain medication for many, many years. A very small group, if you have Ehlers-Danlos, if you have, a connective tissue disease that you're having dislocations every day, maybe. But for the regular person, if you get a fracture, there's some you got a surgery, you got a big hole in your tummy that's sewn up, it's you can have it for a couple days. It's fine. It's completely fine. But when you're talking about a drug that's starting to get mass marketed, like Viagra did. Viagra is the drug that came to market the quickest, and they got their sharehold of the market was a huge boom because, of course, who doesn't want to end erectile dysfunction? And it was fair game because you had all the different marketing forms. When Viagra was launched, you had ludicrous drug reps that were, models coming into the doctor's office to give the doctor drugs, which of course is brilliant. But when you have that pain medication too, like Viagra's not hurting anyone, but when you have these drugs that might, that cost a lot, not might, I want to be clear, it costs a lot of addiction and a lot of problems. The market embraced it, culture embraced it, but then, illegal markets grew, right? Because, different, cartels and different drug enterprises, it's made in
And then
China,
people are going to the stuff that's not tested properly. It's laced with fentanyl, right? And then they're overdosing. And that's where a lot of the deaths are coming from.
Exactly. So we are a year and a half or 2 years removed from the CDC's change in the guidelines. Before CDC, the Center for Disease Control, they submitted guidelines that said that pain was the 5th vital sign, right? Using blood pressure, pulse, temperature, height, weight, and all that. They're like, no, your vital pain it was the 5th vital sign. They quickly did a 180 with all this opiate problem because there was pushback from the government because overdoses. But so they made all the pushback. They changed the laws. They made us liable. There was Bill Capano, a senator in Massachusetts. He was going to put forth a law project that said that physicians should be responsible for the first 2 weeks of rehab if they prescribe the opiate. So ludicrous things like that. So there was a huge pushback. So of course we changed our prescribing habits. We stopped prescribing it altogether, right? The only people that can prescribe it is pain management physicians in pain management clinics, specialists in that, which are usually anesthesiologists or surgeons or super specialists, right? So we stopped prescribing it. I haven't put pen to paper in an opiate prescription for over 2 years. But guess what? The overdoses are still going on. They haven't lowered. Most physicians do not prescribe pain medication. Overdoses are still happening. Why is that?
Yeah, I mean, it's only... So, I mean, I would look at it and say... Most people would say we need more regulations, we need more war on drugs. And I would say, well, what if we just made it legal? Exactly. And even instead of even getting a prescription, just made it legal. You can go into CVS and get it. At least you're getting something that's not laced. I would imagine. I mean, we saw that in Portugal, right? They decriminalized it, made it available, and the overdoses drastically reduced.
Yeah. People forget. Lawmakers forget that opium, it's out there in the streets in another form. In the heroin trade, it's still alive. So people that are overdosing on heroin still. So now the CDC came out with this. Listen to this. The CDC came out with that and say, hey, physicians are misunderstood our guidelines. No, they should prescribe a little bit more pain medications, and we're not buying it. We're like, no, thank you. We're good. We don't want to go to jail. We don't want to have to lose our licenses. No, thank you. And the CDC is pushing back, like, no. Treat pain, and we are not buying it. So they created an uncomfortable situation for us as the providers. I hate that word. As the doctors, and the givers of care, that I will not touch that drug. I will not touch it because it's too dangerous for my career and for the people I take care of. But the CDC is seeing that there's a lot of suffering being caused by this. So people with legit pain are not getting their treatment because it's too dangerous for us. Point blank, it's too dangerous. So it's wild.
Yeah, I mean, I think there's definitely a connection too with Afghanistan and the poppy fields and their income stream. But I want to get into one more topic before we end this discussion here, which I think has been great. We've gotten into a lot of really key points. I want to get into vaccines a little bit before we get into some solutions. And the reason I want to bring it up is because this is really what the mainstream media is pushing. Here in California, they're making it mandatory. Now it's mandatory if you're going to public school. They're talking about mandatory for every adult. New York's trying to do that. What the media has been pushing just in the last few weeks is measles. And from what I've researched is a lot of the measles cases are actually from people who got the vaccines almost right after they got the vaccines.
I have an interesting bit of information. I made a video about measles for Facebook, right? So I'm listening to all this, the hysteria. So I'm like, you know what? From my point of view, my patients, are my small extended family. So whenever I have a patient that has a doubt about vaccinations, I don't try to convince them. I'm like, hey, what are your doubts with the vaccine? What is your problems with it? Let's discuss it. I'll read. If you bring me, let's say you're my patient, you don't want to get vaccinated. I don't want to force you. I want to start a cool, intelligent, open conversation about them in the exam room. And at the end of the day, I'll respect your decision with the vaccines, because yes, there's some stuff in the vaccines that is very deleterious. There are some ingredients, but as I said in my in previous videos, like, there's no free biological lunch. Like, a lot of the treatments that we get have massive side effects, right? There's people that are, had an infection, and you're given penicillin, but you are wildly allergic to penicillin. You go into cardiac arrest and you died for penicillin, and you would never think that would happen. You're like, oh my God, that's horrendous. So with the vaccines, it's touch and go. As a physician, like I said, I have to go by the guidelines, but I have to respect my patient's wishes. I have to. I make this personal contract with each patient. Hey, I'm going to respect your wishes. I'm going to give you my feedback on it, and maybe we can find a middle ground. If somebody doesn't want to get vaccinated, I absolutely don't want to vaccinate you, because
someone on the other side of the aisle would say, no, everyone needs it because of this herd immunity. which to me
Yeah.
doesn't make any sense, because if you're vaccinated, how could not someone who's unvaccinated be a threat to you?
Absolutely. It's why, and it's more, and this is just another form of kind of government overreach, right? So they're trying to be the ones to control healthcare, right? Oh, I'm going to control vaccines. I'm going to control what insurance you're going to get. So it's kind of it's another tentacle of the octopus of that. No.
Well, what really concerns me is a few pieces, and you could touch on it, but one is that they've set up specific laws for vaccines. So even if there are issues, you got to go through the vaccine court system, which is a whole separate court system, which tells me that they already know something's up with vaccines because they're limiting the liability with the vaccine manufacturers. Then I look at someone like Bill Gates give a TED talk about overpopulation, saying that one of these factors need to go to zero. And then he's saying if we do a great job with vaccines, we may be able to reduce that number. And then you see reports from, the last few decades of where the government tested in areas like Africa and South America vaccines that sterilized populations. So, I mean, I'm looking at those three factors and saying there probably are some vaccines that are safe and effective. But for everyone to say every vaccine is safe and effective and just take it without questioning, I think is pretty dangerous.
Yeah, there are vaccines for yellow fever and typhoid fever. But if you're allergic to eggs, you cannot have it. So it's not, imagine a world where you're allergic to eggs. You can't prove it, but there's a law in place making you get what you're allergic to. So, like I said, it's that we need that freedom to have that conversation with our doctors, to sit down and say, hey, Dr. Vasquez, vaccines scare the shit out of me. Is that my answer will be, it's okay. Let's sit down. Let's talk about it, like we talked about it here. So I think it should be the right of patients to deny the care. I mean, if there's a right that you have, if you are paralyzed and you have ahead of time written instructions of, hey, if I am paralyzed and intubated, I want to be taken off life support, they have to be respected. Those advanced directives have to be protected. So if you say that with that, you have to do it with all care. And I understand herd immunity and all that stuff, but still, as a doctor, I respect the privacy and the decisions of individual patients more than the herd, because it just takes away your personality. It takes away the individuality and your personal freedoms. And the United States is about that, about your personal freedom. This is supposed to be the country that's the freest. So it's
well, that's what we're sold, right? I think we're finding out that that's not true. So, I mean, their big push is with measles, right? They're saying measles is becoming a new epidemic. We got to do new laws because of measles. How many people are dying because of measles? Like, should I be afraid to die from measles?
It's been, I think, one of my partners, Dr. Nelson Medina. Shout out to Dr. Medina, by the way. He's probably seeing this right now. Around 300 people have died, and those are the numbers that are given to us by the CDC. Can I verify that? Be 100% and say, hey, I have all the names. Listen, I can't.
300 in what time period? The past few months?
Apparently in the past year or so.
Okay.
And I haven't checked the backlog just to see, okay, last year, how many? Because there's a lot of measles that is acquired to travel, right? So people travel to endemic places where there's populations that they have a higher rate, and that's the way a lot of times you get this. So I would have to search for that information, but I think in years past, it's kind of similar similar numbers of people getting measles and other viral infections, by the way. Right, measles is not the only viral infection. There's tons of chikungunya fever, dengue fever, influenza. So there's tons of viral infections. They're part of sort of the or biosphere, right? Viruses and bacteria. So it's part of our human experience. Jesus, it's a catch-22 for me as a physician. I'm supposed to recommend vaccines, at all cost, and I do, but I respect my patient's wishes. If you have a wish or a problem with that, I would definitely not make you have that vaccination, and that has to be the bottom line, because it respects the individual desire for that person.
Yeah, I think that's a really good point. Yeah, it's just about the individual freedom, which is I think the most important thing. So to wrap this up, we've talked about a lot of issues from the cost of healthcare, the regulations of healthcare, the way the industry is set up to kind of box you in to do certain cares and really stifle innovation. If we were looking at this from a political perspective, we have one side that's shouting, we need universal health care, the government should mandate vaccines, they should pretty much tell us what to do for everything. What would be your ideal solution to improve this system currently?
My ideal solution is have an open conversation with your doctor about other ways to get to his care, to access the care of physicians, because it's not coverage. If you come and see me with Affordable Care Act or Obamacare, however you want to call it, I have 15 minutes for you. 15, that's it. Not because I'm a bad doctor, not because I sold out. It's because that's what you have slotted, because I'm obliged to see, a 50% of my practice has to be those patients, and I have to see a certain amount a day. So I have to fit its time bracket. So doing in an 8-hour day, I can see 20, 25 patients. You divide that time, 15 minutes per 20, 25 patients. That's more than an 8-hour day. So physically, I cannot see more patients than that. So if I take 5 more minutes with you, I'm screwed. I'm out of the clinic late already. So it's all those government mandates make for stricter guidelines when it comes to getting your care. You want your doctor for a longer time. You want to talk to your doctor. You want to have access to your doctor. Well, the government is full-on hands-on control of this. It's going to be less and less time. It's not going to be doctors in the long run. They're going to push for mid-levels, which I'm not against, by the way. I want to make that clear. They're going to push for more involvement of people that are non-physicians giving you your care. And you're going to have a more distant relationship with your doctor. So if you want and you love your relationship with your doctor, universal healthcare is not the way to do it. The way to do it is a free market. Let's keep what we have, the single payer set that we have, Medicare, Medicaid, and the VA. Let's expand on them a little bit. Maybe have physical sites, open more public hospitals and that type of thing. Have residents.
Well, would you say that when you have, you gave Puerto Rico as an example, so if you were to open up public hospitals and expand on the Medicaid, Medicare, and low-income programs, I would imagine in Puerto Rico, one of the major problems was probably just people taking advantage of the system and going to a doctor with things that may not have been necessary.
Yeah, absolutely. When you have that free, I'm having an experience here in a lot of people immigrating from Venezuela here to the States. So they don't know how the system works. So they think that having this type of insurance sometimes means that you can go, you can get everything, and it's limited, right? If the government controls your healthcare, they'll have the control of what medications you can use. They'll have the control of when you can get that hip replacement, right? If you want a cosmetic procedure, and that's going to be outside of the realms of your possibility, let's say. So everything's going to be controlled. Time is going to be stricter for doctors, and your capacity to say, oh man, geez, I have this little pain in my ankle. Let me just see Dr. Vasquez because I want to, just talk to him for reassurance. You're not going to have that. You're going to call and you're going to say, when can I schedule a visit? It's going to be 2-3 months out because the number of patients is going to be overwhelming, and we're going to be overrun. So the cost of everything's going to be controlled by the government, imaging studies, MRI. So people think that that's going to be a free-for-all, and that, universal healthcare means that I can get everything I want. No. You're going to have access when the government wants, when the government deems necessary, just like in Canada. In Canada, it's when they can give you an appointment, they'll give you an appointment. If the treatment is not covered, well, it's not covered. So it's, I want my middle class to reap the benefits of working hard. I believe that in the United States, we work really hard for what we have. Like yourself, you're an entrepreneur. You work really hard, and you deserve what your spoils, the money and the earnings that you so hard, so adeptly and hardly work for. So you can reap the benefits of that and get your own health care back. Get a more affordable health care back, not have to pay more with a bigger deductible just so you can pay a crappy plan for everyone else,
Yeah, I mean, I think that's what it comes down to. At least my whole thing is just morally, how can you steal from someone else, even if it's you quote unquote the rich or corporations, and then give to another person?
It's middle class that's getting hit. Like I said, Walmart, one of the biggest companies in the United States, it made millions, made a killing from this because they have the resources for that. But
the smaller mom and pops that want to actually give their people health care are then basically cut out from the Amazons and the Walmarts. So, really, again, it's just big government protecting the large corporations who we've talked about are pretty much all owned together with the pharmaceuticals, the agriculture, the medical insurance, the media companies. So it sounds like the solution is deregulation, not more regulation.
Yeah, direct primary care is a good way. I would encourage all your listeners and everybody that comes upon this podcast, hey, if you think your doctor's not seeing you for a long enough time, or if you don't like the current paradigm, search for another way. Go to Google, search for direct primary care doctors, telemedicine, independent doctors. Support that movement, because that movement is what's going to ultimately allow you to control back your healthcare. Sitting down a half an hour with your doctor. If I'm able to see 10 patients a day only, imagine how much more improved would the outcomes be. They wouldn't have to see me that often because a sit down of a half an hour with an internal medicine physician, well, that solves a lot of problems, and we could, make some good change and good progress. But in 10 minutes, and then tethered to the computer, it's tough.
Really good points. This has been a great discussion. Dr. Vasquez, thanks for coming on. Someone wants to start following you. Where can they find you?
Yes, they can find me on Twitter. It's at Dr. Yared. So it's at DRYARED. On Instagram, I'm as Octagon Doctor because I'm also a ringside physician. So it's at Octagon Doctor, DOCTOR. On Facebook, I'm under Octagon Doctor as well, and I have a cool new Facebook page that's called Rice and Beans Doctor, which is I'm making cool videos, very graphic videos, bringing a lot of value, explaining disease processes and all that. And I put excerpts of that page on all my social media, so you're gonna get a chance to see all that stuff. So follow me. In 2019 and 2020, I want to bring a lot of free value and information to the digital space, because with all this stuff happening and the squeeze in time, I want to bring that value to my patients online and to all the population. So, follow me.
Awesome.
Good stuff to come.
Well, definitely go follow him. Subscribe to us down below. Hit the bell icon so you get notified when we go live. Also, you can find us on iTunes. But really, you should go to nowdaily.com. Subscribe there. Sign up for the email list because who knows how long they'll keep conversations like this on YouTube. So, Doc, Octagon Doc, we're going to let you go from here, and we'll talk soon.
Awesome. Thank you, buddy. Appreciate it. Awesome talk.
Talk soon. Bye.
Thanks for listening. This has been Now Daily with Robert Crawford, uncovering real stories worth sharing. Want more? Visit the website nowdaily.com/show.